I stopped telling my patients that AFib has symptoms because for most of you over 60, it doesn't. It fires silently. No chest pain, no racing heart, just a stroke out of nowhere. In the next 12 minutes, I'm going to show you 5 signs your heart rhythm is already off, and one of them you can check right now before this video ends. I had a patient, 71 years old, passed every routine checkup for 4 years straight. Sign number 3 on this list was the only clue. He's alive because we caught it. And sign number 4, your doctor may have already tested you for it and still missed it. Stay with me. Here's what nobody's telling you. AFib, atrial fibrillation, is not a heart attack. It's not a blockage. It's an electrical malfunction. Your heart's upper chambers stop beating in rhythm and start quivering like a bag of worms instead of pumping cleanly. And when that happens, blood pools. It clots. And that clot travels straight to your brain. That's a stroke. Not someday. Not maybe. AFib makes you 5 times more likely to have a stroke than someone without it. 5 times. And right now, over 12 million Americans have it. At least 30% of them have no idea. That 30% is who this video is for. Here's what makes this rhythm so dangerous. It doesn't stay. It comes and goes. It can fire for 30 minutes while you're sleeping and vanish before you wake up. Your heart looks perfectly normal by morning. You feel fine. You go to breakfast. You have no idea. Your brain just spent 30 minutes at serious risk. That is the enemy. Not the AFib you can feel. The AFib you cannot. Let's get into it.
Sign number 1. Your pulse has a secret, and nobody taught you to read it. Start here. This one costs nothing and takes 60 seconds. Put 2 fingers on the inside of your wrist, just below your thumb. Feel that beat? Now count it for 60 full seconds. Not 15 seconds multiplied by 4. The full 60. Here's why that matters. And this is the part most people get wrong. You're not counting speed. You're counting rhythm. A normal heart beats like a metronome. Steady. Even. Beat. 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 What you're feeling for is this. Is every gap between beats the same length? Because AFib doesn't always make your heart race. Sometimes it just makes it stutter. An extra beat here, a long pause there, then 2 beats close together. That irregularity, that's your signal. Most people check their pulse and say, it felt fine, but they were only counting beats per minute. They weren't listening to the spacing. That's the difference between catching this early and missing it for 4 years like my patient did. If you feel anything uneven, anything that makes you think, wait, was that normal? Write it down. Note the time, note what you were doing. We're going to come back to that at sign number 3, because timing matters more than most doctors explain. Here's what surprises people about this sign. Your pulse can feel irregular for 30 seconds and then snap back to normal, and you'll think you imagined it. You didn't. That brief window is exactly what silent AFib looks like from the inside. Do that check tonight, before you go to bed, and again in the morning before you get up. Those are the 2 windows when AFib is most likely to surface, and most likely to go unnoticed.
Sign number 2. Your body is sending you a signal, and you've been calling it old age. This next one surprises almost every patient I tell it to. You walk to the mailbox and you're winded. You climb 1 flight of stairs and you need a minute at the top. You carry 2 bags of groceries from the car and your heart feels like it's working twice as hard as it should for a task that simple. And you thought, I'm just getting older. My stamina isn't what it was. Here's what's actually happening. When your heart misfires, when those upper chambers quiver instead of pump, Your heart loses up to 30% of its pumping efficiency. Not permanently, not all the time, but in those moments when AFib fires, your heart is delivering significantly less blood and oxygen to your muscles with every beat. So your legs feel heavy after one flight of stairs, not because your legs are weak, but because your heart is quietly misfiring and your muscles are being starved of oxygen in real time. You've been blaming your age for your heart's electrical problem. Now, here's the part that makes this sign easy to miss. The fatigue doesn't come during the AFib episode. It comes after. You feel fine during the walk. You feel it when you stop. That delay makes people disconnect the two. They don't think, my heart just misfired. They think, I need to sit down. I'm out of shape. The question I want you to ask yourself is this: when did this start? If your exercise tolerance dropped noticeably in the last 12 to 18 months, not gradually over a decade, but in a shorter window, that is not normal aging. That is a physiological shift, and it needs a date and a conversation with your doctor. One more thing about this sign that almost nobody talks about. The fatigue from silent AFib is different from regular tiredness. It comes in waves. You can feel fine for 3 days and then suddenly exhausted on day 4, then fine again. That inconsistency is the fingerprint. Regular aging is gradual and consistent. AFib fatigue is unpredictable and episodic. Keep a log, seriously. Write down the days you feel unexpectedly wiped out. 3 weeks of that log will tell you and your doctor more than a single office visit ever could. Sign number 3. You're sleeping 8 hours and waking up like you slept 3. I've never seen another channel talk about this one. You slept a full night. You know you did. You were in bed by 10, up at 6, 8 hours. And you wake up feeling like you've been hit by something. Heavy, foggy, like sleep didn't actually do anything. You've probably blamed your mattress, or your pillow, or stress, or age. Here's what I'm going to tell you that changes everything. AFib fires most frequently between midnight and 6 a.m. That's not a theory. A 2019 analysis published in the Journal of the American Heart Association tracked AFib episodes across thousands of patients using continuous heart monitors. The episodes clustered overnight, during the exact hours you're supposed to be restoring. When your heart misfires during sleep, 2 things happen. First, your brain is deprived of its optimal blood flow during what should be its deepest recovery phase. Second, your body registers a physiological disturbance and briefly activates your stress response, even though you don't consciously wake up. You have no memory of it, but your body spent part of the night fighting a cardiovascular disruption instead of resting. That is why you wake up exhausted after 8 hours. And here's the detail that connects back to my patient I mentioned at the beginning, the 71-year-old who passed 4 clean checkups in a row. His one consistent complaint, the only symptom he could name, was that he never felt rested. His wife said he'd been saying it for 2 years, woke up tired every single morning, blamed the mattress, bought a new one, still tired. That was sign number 3. That was the thread we pulled. We put him on a continuous heart monitor for 14 days. On day 6, it caught a 40-minute AFib episode at 2 a.m. while he slept soundly. No racing heart, no chest pressure, nothing. Just 40 minutes of his blood pooling in his left atrium while he dreamed. If you have been consistently waking up unrefreshed and nothing explains it, I want you to ask your doctor specifically about a Holter monitor or a continuous rhythm patch, not a standard EKG. I'll explain exactly why in sign number 4, because this is the part that changes everything.
Sign number 4. Your doctor tested you for this. The test was designed to miss it. If you only remember one thing from this video, let it be this, because it goes against what most people believe about their own medical care.
A standard EKG takes 10 seconds of your heart's electrical activity. 10 seconds. It prints out a strip of rhythm data, and your doctor reads it and says your heart looks normal. And they're right. For those 10 seconds, your heart was normal.
Here's the problem. AFib doesn't wait politely in the waiting room. It doesn't perform on command. It comes and goes on its own schedule. And the chance that it fires during the exact 10-second window of your annual EKG is extremely low. A 2018 study out of the European Heart Journal followed patients with confirmed intermittent AFib, patients who had documented, proven AFib episodes, and a significant portion of them had normal standard EKGs because the AFib simply wasn't firing during the test. So your doctor ran the test. The test worked perfectly and still missed the rhythm. This is not your doctor's fault. A standard EKG is the right first tool, but it is a snapshot. AFib requires a film, and there is a difference between those two things that most patients are never told. Here's what I tell my own family. If you have any combination of signs 1, 2, and 3, irregular pulse, unexplained fatigue, and unrefreshing sleep, and your EKG came back normal, the correct next step is not reassurance. The correct next step is extended monitoring. A 24-hour Holter monitor is standard. A 14-day patch monitor is better. And if your doctor is resistant to ordering one, here is exactly what to say. I would like to rule out paroxysmal atrial fibrillation with
Use that language. Write it down. Take it with you. Paroxysmal. That word means intermittent. It means comes and goes. It is the specific term for the type of AFib that standard EKGs miss most often. When you use that word in the office, the conversation changes. And if your doctor still dismisses it after you've named 3 symptoms and used the correct clinical language, get a second opinion. I tell my own family this. Your annual EKG is not a rhythm clearance. It is a 10-second photograph of an electrical system that runs 24 hours a day.
Sign number 5. A free app on your phone can detect this in 60 seconds. Most people don't know it exists. This is the one I personally use every single day. If you have an Apple Watch Series 4 or later, you already have an FDA-cleared AFib detection tool on your wrist. The ECG app built into that watch takes a 30-second single-lead rhythm reading and flags irregular patterns consistent with atrial fibrillation. It has been validated in peer-reviewed research. It is not a toy. It is not a wellness gimmick. It is a cleared medical device that cardiologists take seriously. But here's what most people don't know, and this is the part that surprises even my most informed patients. You don't need a smartwatch. There is a free application called Cardia, made by AliveCor, that turns your smartphone into a medical-grade heart rhythm detector. You place 2 fingers on the sensor for 30 seconds. It produces a single-lead EKG reading, it flags possible AFib, and it can share that reading directly with your physician as a PDF. A 2021 study in the journal Circulation tested this technology against standard clinical EKGs in a community screening population. The sensitivity for detecting AFib was over 93% in a free app on a consumer smartphone.
Now, I want to be precise here because precision matters. This app does not replace a clinical diagnosis. It does not replace your doctor. What it does is give you documented evidence of an irregular episode, time-stamped, readable, shareable, that you can bring into an office visit instead of just describing a feeling. There is a difference between telling your doctor, "Sometimes my heart feels funny," and handing them a printed rhythm strip from last Tuesday at 2 a.m. showing 40 seconds of irregular electrical activity. That difference is the difference between being taken seriously and being reassured. Here's how to use it. Download Cardia. It is free. Do a reading first thing every morning before you get out of bed. Do another one at night before sleep. Those are the 2 highest yield windows based on when AFib episodes most commonly occur. If you get a reading flagged as possible AFib, do not panic. But do not wait either. Screenshot it, note the time, call your doctor that day, and use the words from sign number 4. Paroxysmal atrial fibrillation, extended monitoring, Holter or rhythm patch. That sequence, morning reading, flagged result, clinical language, extended monitoring request, is the exact pathway that catches silent AFib before it becomes a stroke. This is what I personally do every single morning.
Not because I have AFib, because I know what I know. And what I know is that the rhythm that kills is the one nobody checked for.
Let's do this right now, together. Sit up straight wherever you are, feet flat on the floor. Put 2 fingers, index and middle, on the inside of your opposite wrist, just below the base of your thumb. Press gently until you feel the pulse. Now just listen to it. Don't count, just feel the spacing between beats. Is it even? Is every gap the same? Or is there something unsteady in there? A beat that comes too soon, a pause that runs a little long? Stay with it for 30 seconds. If it felt perfectly even, good. Keep checking. Once in the morning, once at night. Make it a habit the way you'd make taking your blood pressure a habit. If something felt off, even slightly, even for just a few beats, write it down right now. Time, date, what you were doing. And download Cardia tonight before you go to sleep. Do your first reading before you get out of bed tomorrow morning. That is not an overreaction. That is exactly what catching this early looks like. If you want more of this exact kind of thing where I walk you through it step by step, subscribe. I'll be here every week, and it will always be this specific, this direct, and this useful.
Here's what we covered. Sign number 1, your pulse has a rhythm, not just a rate. Feel for uneven spacing, not just speed. Sign number 2, unexplained fatigue after light activity may be your heart misfiring, not your age. Sign number 3, waking exhausted after a full night of sleep is one of the most overlooked signs of overnight AFib. It's one of the most overlooked signs of overnight AFib. Sign number 4, a normal EKG does not rule out intermittent AFib. Ask for extended monitoring by name. Sign number 5, a free smartphone app can produce a medical-grade rhythm reading you can take directly to your doctor. Which one of these surprised you most? Tell me in the comments. I read every single one. You now have a system. Your heart rhythm check is set up. But there is one more piece that most people never address, and it can trigger an AFib episode even when everything else is right. There is a hormone that spikes at night in people over 60 and destabilizes the exact electrical system we just talked about. It is not melatonin. It is not cortisol in the way you've heard about it. And almost nobody is talking about it in the context of heart rhythm. I made a video on it. Watch it next. Because the 5 signs you just learned are the detection system. That video is the prevention side. You need both.